Welcome to the Stroger Hospital's Training Module number 7, the cleaning process for the patient room and the patient restroom after the patient has been discharged. We're glad you're here.
At Stroger Hospital, we believe that thorough environmental cleaning and disinfection are crucial to the health and well-being of patients, guests, and staff. As such, it is vital to understand the importance of environmental cleaning and disinfection of patient rooms. Our goal is to remove the contamination of microorganisms from surfaces and equipment where patients receive care in order to minimize the risk of disease transmission and cross-contamination. In this training module, you will find that many of the cleaning processes and techniques that you learned in training module number 6, cleaning the occupied patient room, are the same or very similar to what you will be learning here in this module. The essential difference will be that there are additional cleaning tasks that we perform after a former patient has been discharged. In the discharged patient room, we are more thoroughly cleaning and disinfecting the room in preparation to receive occupancy from a new patient. Why is the discharge room more thoroughly cleaned and disinfected? It is to help prevent cross-contamination of viruses, bacteria, and microorganisms transferring from the old patient to the new. A summary of what we will be covering in this training module includes: Number 1.
Coordinating your work with other members of the Stroger medical team as they perform their tasks to prepare the room for a new patient.
Number 2. Pre-inspection of the room for planning your work. Number 3. We will discuss safety, emptying waste containers, and removing trash. Number 4. Safely removing linens, such as sheets and towels, followed by training on how to thoroughly disinfect the bed mattress, side frame rails, headboard, and footboard. Number 5. High and low dusting of the patient room, emphasizing more thoroughness in this task simply because we can more easily do this work when a patient is not present without the risk of stirring up dust in the patient's indoor air environment. Number 6. Disinfecting surfaces, especially what we call high hand touch surfaces. Number 7. Spot cleaning surfaces. Number 8. Cleaning and disinfecting the patient restroom. Number 9. Dust mopping the floor. Number 10. Performing final inspection of the patient room. Number 11. Damp mopping the floor. Number 12. Double checking everything as a final step before exiting the room.
Putting on your PPE. Start by thoroughly washing your hands in the manner specified in the Stroger Training Module number 3, titled Hand Washing and Hand Hygiene. After completing your hand washing, put on new clean gloves, being sure to inspect them first to make sure that they have no holes or tears in them.
Properly positioning your cart. Remember to position your cart properly next to the patient room door opening. Do not block the doorway with your cart. Next, knock on the patient room door and do so even if the door is already wide open. This is a polite way of announcing that you are coming in and also asking for permission to enter. Since this is supposed to be a discharge room, there should not be a patient inside. Sometimes, a mistake in scheduling can be made, however, so don't just assume the room is empty. Wait to hear a response before entering. If you do not hear a response, knock again. If you still do not hear a response after the third knock, enter slowly, being careful to listen and look for the presence of a patient or some other person in the room. If no one is in the room, you may begin your work and assume that it is truly an empty room that the patient has been discharged from. If there is other medical staff working in the room, say hello and introduce yourself with a smile. Coordinate and plan your work around the other medical staff to allow for smooth teamwork and efficiency preparing the room for the next patient.
When placing the wet floor sign at the entrance to the room, be careful not to block or only minimally block the entrance to the room with the sign. The sign needs to be visible, but should not be right in the center pathway of the walking lane into the room.
Your next step should be to inspect the area before pulling out trash from the waste containers. This is to determine which portions of the room need special attention and allows you to plan your work efficiently. This step also lets you gather loose trash and place it in the wastebasket before pulling the trash from the cans. As you should know from your Stroger Hospital safety training, it is important that you keep the biohazardous waste which is located in the red trash cans with red liners separate from regular waste. Never mix the two together. Last thing, when you inspect the room or as you are performing your work, you may find personal items that were left behind from the previous patient. If you do, gather these items, turn them into your supervisor so that they can be returned to the patient.
Be safe. Avoid pokes from needles and sharps. If there is a large amount of waste in a receptacle, do not use your hands or feet to compress trash. Never compress trash with hands, feet, or any other part of your body. This is to prevent injury from loose sharps that might have been improperly disposed of in the trash. When pulling trash, gather the trash liner at the upper edges and tie the liner closed. Lift waste liner slowly out of the receptacle, keeping it away from your body. Never let the trash liner filled with the trash bump up against your legs or any other part of your body while carrying the trash to the designated container. Before replacing the trash liner with a new clean liner, wipe the interior and exterior of the waste receptacle to disinfect and to remove any spills, drips, smudges, or fingerprints.
Like pulling trash, the removal of soiled linens must be performed with good attention to safety so that you avoid accidental cuts or pokes from sharps that may have been improperly left in the folds of the bedsheet, towels, or other linen. For the removal of bed sheets, start at the far corner of the bed and pull the corner of the sheets into the middle of the bed. Do this for each of the 4 corners. When you pull the corners to the middle, grab by pinching the farthest edge of each corner with your fingertips. Do not grab sheets or other linens with a closed fist compressing a bunch of material into the palm of your hand. Also, once you pull the corner of the middle of the bed, let the corner drop out of your fingertips into the middle. Do not push the sheet down onto the bed with your hand. If necessary, you can repeat this process folding the farthest corners into the middle. Use your fingertips. Let the sheet corner drop to the middle, but do not compress. When you have finished folding the corners in, you will have a small bundle of sheets. Again, using fingertips only, pick the bundle up by your fingertips, minimizing the amount of linen materials that you touch with your hands. Once you pick up the bundle of sheets, do not shake the bundle. Always carry it gently. You should use a similar process for gathering towels, specifically being safe and carefully watching out for needles or other sharps that may be hidden in the folds of a towel. Always handle the towels and other smaller linens by your fingertips. Fold into the middle and do not shake out towels.
Place soiled linens in the blue bag soiled laundry container. Let the soiled linens drop in and fall into the bag under their own weight. Never compress the linens into the bag by pressing them down with your hands or any other part of your body.
High and low dusting. Always start by first doing high-level dusting, then work your way down. Because this is an unoccupied, discharged patient room, now is the time for you to perform a more thorough dusting.
Especially around the areas that needed to be avoided when the room was occupied with the patient and guests.
2 of these critical areas are the ceiling and wall vents. Remember that most patient rooms have a wall vent above the patient bed, a ceiling vent located in the ceiling, and a door vent located in the lower portion of the main patient room door. When high dusting, take the microfiber duster and the extension tool and dust shoulder height or higher in the area. Dust the walls, ceilings, vents, ledges, furniture, fixture vents, and the wall area around vents. Dust window sills, baseboards, and chair rails. Generally, you need to look for dust accumulation on any horizontal surface that can catch dust and make sure that you thoroughly clean it off.
Sanitize all horizontal surfaces, and with an emphasis on what we call high hand touch areas. High hand touch areas are surfaces that get a lot of hand traffic. If you look around the room, you can see what the high hand touch surfaces are. Examples include doorknobs, light switches, bed rails, chair rails, patient food tray tables, telephones, TV remotes, nurse call buttons, cabinet pull or push knobs, counters. Sanitation or disinfection cleaning is accomplished by applying the neutral disinfectant cleaner to the surface. Then remember, you must allow for the necessary 10-minute wet dwell time for the disinfectant to kill germs, so follow this process. Apply the neutral disinfectant cleaner. Allow it to sit for 10 minutes of wet dwell time. Wipe clean using the appropriate wiper. Use a blue wiper when cleaning in the patient room. Use an orange wiper when cleaning the patient restroom. Leave the surface in a clean and streak-free condition.
Spot clean all vertical surfaces. Vertical surfaces are areas such as walls, doors, door frames, and cabinets. Look for places on vertical surfaces where dirt, germs, splashes, or smudges can accumulate, and focus your cleaning attention on these areas. Examples include walls near or around the waste can, which can often get splashes or spills. Door push plates or door frames are frequently touched by hands and can have smudges and fingerprints that need cleaning. Cabinet doors can also have fingerprints, smudges, and accumulated dirt. Spot clean vertical surfaces such as these using the neutral disinfectant cleaner and the appropriate wet dwell time to let the disinfectant kill microorganisms.
Cleaning the patient restroom. Prepare to clean the restroom by placing the wet floor sign next to the restroom door. Next, high dust all horizontal surfaces in the restroom. For disinfection cleaning of surfaces and fixtures in the restroom, make sure you are using neutral disinfectant cleaner and orange microfiber wipers. Remember, orange for bathroom cleaning only, blue for room cleaning only. Remember, on all bathroom surfaces, it is very important to apply the neutral disinfectant cleaner and allow the full 10-minute wet dwell time for the disinfectant to fully kill germs, viruses, and microorganisms. Make sure to clean mirrors and dry with paper towel to prevent streaks. Clean the sinks and the surrounding area, such as the counter, underside of the bowl, and the piping under the sink. Make sure to spot clean all splash marks on the wall that may be adjacent to the sink, the toilet, and the shower. Clean the shower, starting at the top and working your way down, and being sure to scour the shower basin floor. Next, start disinfecting the toilet by first applying bowl cleaner into the bowl of the toilet and allowing it to sit for 10 minutes or more. Apply neutral disinfectant cleaner to the rim of the toilet, to both sides of the seat, and to all exterior surfaces of the toilet, again allowing for proper wet dwell time. Wipe all surfaces of the toilet down and leave in a clean and streak-free condition. When cleaning the inside of the toilet bowl, use a Johnny mop to clean the inside and then replace the Johnny mop in its carry container. Note: do not use toilet bowl, brush, or Johnny mop on the outside of the toilet bowl or any other surface other than the inside of the toilet bowl. Remember to empty the bathroom waste can, taking all the same precautions used in emptying the patient room waste can. For example, do not compress the waste. Do not let the full waste bag you have pulled from the can bump up against any part of your body. Wipe the waste can clean and reline with a new clean liner.
Refill dispensers for soap, hand towels, and toilet paper. Stop. Remember, you have just cleaned the restroom. Your gloved hands are contaminated with the microorganisms of the bathroom. Before you proceed to refill the dispensers and restock towels and linens, you must dispose of your gloves. Wash your hands and put on new, clean gloves. Once you have washed your hands and re-gloved, you can proceed. Restock paper towels with the fold properly facing downward so that the towels dispense as they are intended to. Refill the toilet paper dispenser. Make sure spare rolls are stocked in the room. Refill hand soap dispensers. Refill shower toiletries. Replenish bath towels, hand towels, washcloths, and other linens.
Dust mopping the floor. Always make sure you dust mop before you damp mop. This excludes instances of an obvious blood spill in the room, in which case it is appropriate to clean using the Stroger Hospital protocol for blood-borne pathogen cleaning, as described in the Standard Operating Procedure and Training Module number 24. When dust mopping, make sure you work clockwise and around the room, and use an S stroke while keeping the leading edge of the mop head moving forward. Be sure to move any furniture and dust mop underneath. Make sure you dust mop carefully in corners, along edges, and on the baseboards. Be careful not to lift or shake the dust mop during or after use, as this will cause excess dust to be lifted airborne into the indoor air environment.
Final inspection before damp mopping. Before damp mopping, take a moment to do a final inspection of your work and make sure that you have not missed anything. This is the time to inspect curtains and look for stains or portions of the curtain that might need repair. Be sure to check the sharp container and arrange for its replacement if it's filled to capacity. Remember, Sharp's containers are sealed for your safety and the safety of everyone at Stroger Hospital. Never attempt to open a Sharp's container. Double check all soap and hand sanitizer dispensers to make sure they are properly refilled. The same final check should be made to all paper product dispensers and all towels and linens. It is important that you check door hardware and metal kick plates to make sure they have been properly cleaned. If any item in the room needs repair or any lights are burnt out, be sure to report this so a work order can be submitted to the Stroger Buildings and Grounds Department.
Damp mopping. Prepare to damp mop the floor by placing a second wet floor sign inside of the room. You should have one wet floor sign outside of the room at the entrance and one in the room, with both being highly visible to minimize the risk of slips and falls. Begin damp mopping the floor, working around the room using an S stroke, paying a special attention to corners and baseboards. Make sure to move any furniture and mop underneath. Make sure you mop behind the door. If you find any spills or stains on the floor, on the baseboards, or in corners or edges that you cannot remove, report these to your supervisor. However, before reporting this, make sure you have made every effort to remove the spot, stain, or spill yourself.
Take one final look around the room and the restroom to make sure that you haven't left any of your tools or supplies behind. Also, double check your work to make sure you haven't missed anything. If there are any repair and maintenance tasks that need to be performed, note these and report this to your supervisor so that a work order can be submitted to the Buildings and Grounds Department of Stroger Hospital.
Thank you for participating in Stroger Hospital's Training Module number 7, Cleaning the Discharge Patient Room and the Patient Restroom.